let your head fall. Good drop.
Wow.
Drop your shoulders. Good. Hey everybody, this is Dr. Warren and Madison.
Hello, hello.
As we call her Maddie in the office, she's an assistant here. And what did you say when I was walking by in the hallway?
I said my scalenes are bad.
They're bad. You got a scalene problem.
Yes,
right?
I do. Today I do.
And so I hear in similar words relative to having like tension, irritation in the scalene area. What are the scalenes? Scalenes are a group of muscles in the front. Oh, did you do your anatomy review? Tell me what the scalenes are.
They're a group of muscles in your neck, and you have 3 of them, the posterior, middle, and anterior, and their job is to kind of rotate your head, flex your head.
Yeah, a little lateral flexion, a little rotation. They help you breathe as well if you're really in need of some air. They're called an accessory muscle to breathing. Or if you're just like a stressed out college student like we can be at times in college and taking like drinking an adverse amount of Celsius. And,
lemon lime, let me tell you guys something. Lemon lime.
Is that right?
Yes.
I had a lemon lime Celsius this weekend prior to a stair climb, prior to putting on
Saturday.
Yeah, firefighter gear, and I'm telling you, my heart felt like it was going to explode.
Yes,
I don't recommend it.
absolutely.
I don't normally drink Celsius, like I usually drink espresso. I like coffee.
They should sponsor our office, honestly.
Celsius, did you hear that?
Please, Celsius.
Does your heart want to explode out there while you're climbing stairs?
Right.
Terrible. But yeah, we, just coming back. Oh yeah, breathing, accessory muscles, scalenes, got a scalene problem.
Yep.
That's how you summarize right there in my words. And so I see that problem quite often. So where does that problem come into play relative to just, not everyone just has like tight scalenes for no apparent reason, right? A lot of times it's poor breathing habits, stress, like almost 90% of the time that's loose, but a lot of times when I see someone that's chronically stressed, more often than not, their upper traps, their thoracic spine, their neck musculature, especially in that area, is just rigid from overuse. They just lean into that as a result of the stress pattern of breathing. And so also desk workers, people that are kind of here all day long with the elevated arm, that's going to require a lot of stability from this area, and that can be tight. So I see it a lot. But not a lot of people will actually kind of get it treated.
Oh, I'm ready to get it treated.
Okay,
Yep.
So this is how I treat the scalenes, right? From a soft tissue perspective, as well as from a like kind of some things you can do on your own. So we're going to give you the gold standard for some scalene treatment in our office here in Towson, Maryland. All right. So Madison, I'm going to show you how I treat it both sitting down as well as lying down. So we'll start with the sitting first because that's easiest to get to right here. So come on, scoot on back towards me. All right. Now the scalenes can be tight, and the muscles around the neck behind them can be tight. The joints can be restricted. So I'm going to treat it like I would relative to a patient coming in. It's a right scalene problem you described, right?
Yes.
All right. So I'm going to look at the shoulder first. All right. And I'm going to feel how the muscles are moving, how tight they are, and relatively speaking, where I want to focus and treat my Madison shoulder. Okay, and so I feel a little bit of restriction, and then the trap. You told me, hey, treat my trap as well in this video, please, and I'm happy to do that. So I'm going to focus there. Okay,
yes.
I'm going to laterally flex her neck, and I'm going to see how the neck is moving as a whole to see if there's restriction in one way or the other. And she's a little tighter going to the left, but overall, her range of motion and lateral flexion is really good. Rotation's good too. She has a little tiny bit of joint restriction underneath my hand up top here. You feel how when I go there, it's like wall.
Oh, yeah.
Okay? And when I go here, it's like smooth.
Yes.
So that joint right there is going to feel really good when it gets adjusted. Okay?
I'm
Or
excited.
you're going to feel good, and that joint's going to be moving well.
My joint will be happy too.
All the happiness. And then I'm going to palpate first rib. A lot of times when I feel scalene restriction, I'm going to feel, this is first rib here. You feel the tip of my finger. I'm going to press it anterior, and I'm going to laterally flex, and I'm going to sink in like that, okay? And so I'm going to do the same thing over here, and right off the bat I can just feel, that's where I'm going to adjust you, okay? So let's do the scalene work first, okay? You can do it sitting down like this, so I'm going to cup underneath the back of her occiput here. I'm going to traction up. I'm going to use my body to give her a little bit of relaxation by supporting her. And then I'm going to take my fingers and I'm going to space them out over all 3 of the scalenes. And if I don't know where I am, or if I want a little bit of feedback from her, I'll say, hey Madison, bring your right ear to your right shoulder. Good job. And so I'm feeling what pops out, and then relax. And now I can isolate a little bit more onto that area. Hey, do me a favor, Madison. Let's 90-degree turn this chair on the count of 3. 1, 2, 3, turn. Oh, the chair itself. But you went for it. This gives Carly, our awesome photographer, a little bit of help. Okay.
Sorry.
So, no, you're good. I thought you were gonna jump and spin and land it.
I was thinking about how to do it first, and it just wasn't there.
All right, let your shoulders relax. Let your head fall to the left. I'm gonna scoop and bend. I'm gonna lean in and I'm gonna find it, and I'm gonna hang out on it. This is where, remember what levels it inserts to?
Are you asking me?
Uh-huh.
Is it your clavicle? Or what level? C.
Yeah, sorry, what levels in the spine does it, I guess it did.
Wasn't it C4 through 7?
C3, C4, C5, I
Oh.
believe. Oh God, I gotta do my anatomy checkup on that one. Give me a break, okay? That's way down deep in the books of the details, but relative to palpating it, that's the most important thing, is I gotta feel it, I gotta find it, I gotta treat it, and you gotta be feeling better. So here and here, I'm gonna hook right onto that, and I'm gonna lengthen one at a time, okay? This is one way that I can treat it in the chair, and I really like doing this in the chair because I have a lot of control over her head and she's comfortable in this position. And then I can go right into an adjustment. So you mind if I adjust your first rib right there? Good. So you're gonna just let your head fall. Good, drop.
Wow. Wow, is that? I needed it.
It's good. And
Crunchy.
So, let me see you turn to your right. Good. So I appreciate your trust in me that made that adjustment so easy on me, Madison. You're the best. Now you're going to turn your head to your left. Good. I'm saying hi to everyone. Are you saying hi too?
Yeah.
Good. Add a little restriction here. So you're going to turn right. You're going to feel easy release here and right there. Okay?
Mm-hmm.
Turn right. Oop. And last little one. Up. Loose. Good. Turn left. Good. Relax. Relax your jaw. Good. Let your head sink back. So you're wondering, this is the gold standard for turn left. Good. A little bit more turn. Good. Relax. Good. We're going to treat that on the table on your back. Actually.
Okay.
It's a little lower than occiput. It's right there, and we'll feel a little bit more good in range on the table on your back.
Okay.
But yeah, coming back to what I was gonna say. Lay here, butt here, head here. The joints, as it relates to muscular tension, can be treated to help with range of motion or tension in a group of tissues. So, although we're doing a Scalene's video, and that's kind of what I'm scooping down onto right now. I'm still going to treat the joints around that area and that region to help with the overall treatment, because if there's a strong correlation functionally. I treat the joints, I'll help the muscles. I treat the muscles, I'll help the joints. What comes first? Yeah, depends on the person. Tuck your chin.
Ooh.
Good. You got it. Tuck. Intense?
Mm-hmm.
Too intense?
Like pins and needles?
Pins and needles. Yeah, so what's in this region, right? That brachial plexus is right there, okay? So we're gonna be a little bit more gentle in that area. I'll be a little bit more mindful about how I'm pushing through. Turn to the left for me. Good, relax. Good. Drop your shoulders. Good. Okay, now let's work on that region. So what other things bifurcate the scalenes? The brachial plexus is in this general region, okay? And so we gotta be mindful when I'm pushing through that tissue of not pushing right on that nerve, if you will, or that bundle of nerves, because it can be really sensitive. Sorry for that.
No, you're okay. Thank you.
So we're past that. We're good now.
We're fine.
We're good. We're good. All right. So again, I'm gonna come in, and this is another way that I'll treat the scalenes on the table. And it's probably the region I go to the most if I really need to get in, and I need to treat the SCM. Turn your head to your right. Uses that muscle. Turn your head to your left. Uses that muscle to do it. So your neck uses your SCM muscle to turn, and it's kind of counterintuitive to the side that it turns to, but that was just a quick example of it. So I'll show you how I lengthen it. I rotate towards, I scoop around the muscle itself as it rolls right there, and then I'm going to lift your head. You let me do all the work for you, okay? So good, easy length. Now let your head go loose. Good. And then I'm going to scoop. And this, if I'm doing it the right way, if I'm really in the zone, if you will, feels wonderful.
It does.
Alright, so.
I do this to myself.
Yeah, absolutely. You can do some gentle soft tissue work to your neck like this. Careful that you're not pushing on that brachial plexus, causing a little zinger or sensation to occur underneath your hand or into your shoulder. A lot of times TOS or cervical radiculopathies. I'll treat the scalenes like such. I'll treat the neck musculature before I work on it because there's a whole lot of guarding going on when there's nerve irritation. Turn right. Boom. Let me lift you. Let me lift you. Okay, go looser, looser. Oh, you're pro. You're pro. And let it go. I'm going to scoop. Good. So scaling, right? Go like this and go. Yeah. Okay, you can start to see some of the scalenes pop right here. Now bring your head to the side. Try to take it to your right ear to right shoulder. A little harder. Make it work, 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 work. You can see them pop out a little bit underneath my hand. We need to get your scalenes bigger. We need to work those scalenes out, girl. No, it's all good. They're a little. They don't pop as much right here. I could probably get you to do it if I made mine. You see on Carly? Can't tell.
On yours?
They pop out?
Mm-hmm.
Maybe you have to work on your face.
Okay.
Okay.
I will.
So I would do soft tissue work like I'm doing. I would adjust, okay? What makes our office wonderful, in my opinion, is that we have a great team here. So we have people doing rehab and physical therapy and exercises as training, as well as dry needling and glass bore laser. So I can pick and pull from conservative medicine in a healthy way and get to the problem and to the source of the problem without taking something, right? Or without injecting in that area. I think it's a more well-rounded, holistic approach to dealing with these issues, especially scaling issues. Okay, all right, so let me get to the kind of the deep soft tissue work on the scalenes. Loose. I'm gonna slide my hand, I'm gonna lock it in place. My fingers went like this. See that? So not this or like this. I'm trying to scoop and press. Loose. Take your right ear to your right shoulder. I'm gonna block you. Now relax. Relax more. I got you. Good. Yeah, right there. Relax. Okay, you mentioned you have a scaling problem. I looked at your range of motion. I treated you before. You come in here quite a bit. If you were to call your problem to exist in one spot, where is it?
Me?
Where do you feel it?
Mainly, I always carry tension in my traps.
We're down here.
Yeah.
Okay.
But recently, also around my suboccipital.
So you get it here and you get it here,
Mhm.
and then relative to your scalenes, do you get much action in here?
No,
Okay.
not usually.
Cool. So you don't really have like a scaling problem.
No, they're just bad today. And yesterday. I think I slept wrong. I don't know.
That's okay. No, I'm still happy to treat your shoulder and your neck. Yeah. So let's work into the trap. What do you say? Rotate to your right. Good, relax. This is where the trap inserts, is up top. I'm gonna work my way down. Hey, so great job on your anatomy review with your scalenes. I'm impressed.
Thank you.
Madison here is actually pretty low, so she's came in as a. You were like kind of going psych background, not sure which direction you were dance. No, not dance.
That was kind of.
That was Anna, and that was also Mo, who you remind me a lot of.
Yes.
You psych background, thinking about going that route, and then you kind of really switched and gone into pre-law, right?
Yep.
And you're crushing it.
I am.
Yeah, I love that for you.
Always.
Always, baby. Drop that right shoulder. Push your right shoulder into my hand. I'm gonna catch it. I'm gonna block. Try to beat me. Whoa, you're strong. And relax. Go. Loose. This is gonna feel wonderful. Let it go. Good. There you go. Okay, just go ahead and let it fall. There you go. Relax a little bit. Good. Breathe in. Exhale. Madison's a really hard worker here. Patients love her. She's got great energy. She works. She always finds a way to help out, if you will, in any given circumstance. So I really appreciate her effort. She means very well by people when it comes to connecting with them and helping them out. And so I'm happy to work on her scalene problem as well as her trap and her neck issue. And I hope those adjustments in the soft tissue work help you out.
Yes, thank you, Dr. Warren.
And then back to work. Thanks for watching.